Hi, everyone. Welcome to the Top 5 Things Fit Should Know About series. I am Jordan Jaggers, Chair of the Quad AI Fit Committee. In this session of our series, we will cover the top 5 things Fit should know about advocacy. Our guest presenter is Dr. Lynda Kabbash. She is an assistant professor at Harvard Medical School and a practicing allergist at the Beth Israel Deaconess Medical Center. Over the past decade, she has succeeded in positions including the Quad AI Regional, State, and Local Societies, Chair and Northeast Governor, Quad AI Advocacy Committee Chair, and Quad AI Delegate of the American Medical Association. Dr. Kabbash helped craft and spearheaded an American Medical Association resolution on penicillin allergy delabeling, which has successfully accepted as policy in 2024. She considers her vocation as an advocate to be a defining aspect of her medical practice. She fervently believes that with NIH funding seriously threatened at this time, the work of the Quad AI NIH Task Force in cooperation with RSL to encourage ongoing and increased grassroots advocacy is essential. She also anticipates successfully tackling the challenges ahead, including Medicare payment reform 95165 and 1 milliliter for immunotherapy and prior authorization. Welcome, Dr. Kabbash, and thank you for leading this session. I will turn it over to you to get us started on your top 5 items.
Thank you very much, Jordan. It's a pleasure to be here. And I want to thank you and all the FITs for inviting me to talk and give the 5 points about advocacy. So, point 1, physicians and allergists are practices, how we can sustain them and promote the solutions to prior authorization, Medicare payment schedules. Advocacy is working both at a federal and national level, and most recently has begun state level efforts. Point 2, our patients promote penicillin allergy evaluation, testing, decrease antimicrobial resistance and side effects from penicillin alternative medications. 95165 coding and difficulties in reimbursement for immunotherapy. This must be cost effective. Another factor in practice sustainability as well. And we work with the Office of Practice Management, OPM, as well as regional, state, and local societies, the RSL. Point 3, NIH funding. The mission statement for the Advocacy Committee originally spoke only of NIH and research efforts. This is being updated to encompass our practicing allergists' efforts as well. NIH funding is under severe threat, and cuts of up to 44% of the anticipated yearly budget will result in a $14 billion loss for research in the US. A recent example of CRISPR gene editing in a newborn with a rare disease, the infant cannot process ammonia properly. The history of NIH funding has allowed this novel and exciting treatment to occur. Similarly, research on glucagon-like peptide, GLP-1, over the past 40 years has resulted in remarkable treatment efficacy for diabetes and obesity in the general population. NIH funding affects our medical schools, our students, residents, and you, our fellows, and of course, our patients. Point 4, RSL AAIS. This federation of local and state societies is an arm of the Quad AI. The grassroots connections to local legislature, all the way up to Congress and Senate, is critical in our advocacy efforts. We work with Heart Health Consultant Group to strengthen our efforts on Capitol Hill, and now we'll also have help with state legislation. An example of how instrumental these connections are is evidenced in the Health Committee of Congress. HELP is Health, Education, Labor, and Pensions. Many influential sitting members and even chair and vice chair are in districts where our members reside. When visiting the Hill, the key is having a local constituent present in the meeting, along with our advocacy team. Point 5, AMA, American Medical Association, is a much larger organization than our own Quad AI. To belong to the AMA, we need to have 1,000 of our fellows, FAAAAI, as members, and this is a minimum. This allows us a seat in the House of Delegates, where specialty and state societies are all represented. Penicillin allergy policy passed in 2024. This resolution was submitted along with a New England delegation. As a delegate to the AMA for Quad AI, I work with our alternate delegate, Dr. Stephen Tolber from New Mexico, and Dr. Shahab Virani from DC, our young physician section representative at the AMA. Sheila Heitzig and Isaac Voss, our Quad AI advocacy team, are instrumental in these efforts as well as all our advocacy efforts. We are part of the scope of practice efforts at AMA. Also, the National Advocacy Conference on Capitol Hill, where this year there was a white coat session emphasizing Medicare payment reform. As a result, there has been legislation to tie the Medicare rate to the Medicare Economic Index, something which has not been done in 2 decades. And hopefully this will pass at some point this year. So, physician allergist practice, sustainability, Medicare payment reform, Congress adjust Medicare physician payment to rise with rate of practice cost inflation, while Medicaid proposals in the House Energy and Commerce Committee's budget reconciliation might lead to coverage interruptions in this vulnerable population. Prior authorization bills fix this cumbersome and costly process, which affects staff and patients. NIH funding, drastic cuts, which will affect patients, medical students, residents, and the FITs. Penicillin allergy evaluation to delabel increased numbers of patients to combat side effects and antimicrobial resistance patterns. Our patients' welfare advocate for patient care, medication accessibility, and resources. RSL grassroots with participation in local allergy and state associations, and visits with local representatives, state and federal. AMA membership and scope of practice are all a part of what we do in advocacy at Quad AI. We are pleased to have a FIT member, Dr. Zoe Brown from University of Chicago, on our advocacy committee this year. And we also welcome any questions or suggestions. Our email is advocacy@AAAAI.org. So one more time, the points. Point 1, sustain allergy practices and allergists. Point 2, our patients, their wellness and benefits. Point 3, NIH funding and research. And as a side note, there is an editorial in Jackie from the Quad AI task force on NIH. Point 4, RSL AAIS and its role in grassroots advocacy. Point 5, AMA, American Medical Association, national advocacy and policy-making body for the House of Medicine. We just attended an annual meeting in Chicago, and it was remarkable in that there were 3 resolutions, one in the regular body of work, and this was on capping of indirect costs at NIH. And we co-sponsored that resolution with our rheumatology colleagues. Then there was a late resolution with Infectious Disease Society of America, IDSA, on science and NIH funding. And we co-sponsored that as well, in what they call a reference committee hearing, where they review the resolution and there's pro and con mics. There were 55 delegates at the pro mic. It was remarkable. And then an emergency resolution on ACIP, or the Advisory Committee on Immunization Practices. The 17 members were removed while our meeting was going on, and our emergency physician colleagues came up with a resolution, which was, in order to have an emergency resolution passed, you need 75% of the House to vote that it can be accepted as an emergency resolution. And it was clearly accepted and voted in. And there have been efforts to really ask the administration to recommit to maintaining vaccine access to all Americans. Practice Matters comes to you twice a month, every 2 weeks, and it always has advocacy updates in it. So I encourage you to take a look at that. And also, there's a practice management workshop, which is just around the corner in Nashville this year in July. And I know that Dr. Mohammed Yassin and some other doctors have sponsored, I believe, 8 FIT members to attend the workshop. And anybody who can attend, I think it's highly recommended. So again, thank you for listening, and look forward to working with you all. And if you have any questions, please let us know. Thanks.
Thank you so much. Hearing about your experiences has been incredible. So thank you for sharing with us. And thank you again, Dr. Kabbash, for walking us through what advocacy looks like and how we can get involved as FITs. So before signing off, I would like to again thank Dr. Kabbash for volunteering her time. We appreciate the information and guidance you shared for our FITs. If you have any follow-up questions after viewing this session, please reach out to our FIT staff liaison, Mari, at mduran@quadai.org. See you soon. Thank you.